welcome to The Explainer. I am absolutely thrilled you're tuning in today because we're unraveling a genuinely fascinating medical mystery. You know, if you or someone you love is managing type 2 diabetes, you are probably super familiar with tracking blood sugar, monitoring cholesterol, and keeping a close eye on blood pressure. But what if I told you there's a hidden player, this unseen missing mineral that is quietly affecting every single one of those systems behind the scenes? Today, we're going to expose this missing suspect, uncover exactly why it pulls a vanishing act, and show you how to get it back for good. Okay, let's dive into this. When it comes to diabetes, our attention is almost always monopolized by insulin and glucose, and honestly, rightly so. But because we are so hyper-focused on those two, we completely overlook a hidden culprit that's actually causing absolute chaos when it goes missing. It's crazy to think about, but nearly half of all adults in the US don't get enough of this mineral. And people with type 2 diabetes, well, they are especially vulnerable to losing it. The missing suspect is magnesium. And the reason this is so absolutely critical is represented by this massive number, 300. Magnesium is responsible for over 300 enzymatic reactions throughout your entire body. We're talking about the most fundamental processes of life here. It regulates your energy production. It literally allows your muscles to contract and relax. It synthesizes your DNA, and it keeps your heart beating in a steady rhythm. Without it, your internal systems just cannot operate efficiently. So, if it's so incredibly important, why does this deficiency fly entirely under the radar? Well, it's because a tiny, microscopic 1% of your body's magnesium actually circulates in your bloodstream. The other 99%, it's hidden deep within your bones, your muscles, and your tissues. Because it is locked away in the tissues doing all the heavy lifting, a standard blood test often won't even sound the alarm when your overall reserves are running dangerously low. Section 1. The Great Escape. Why magnesium levels fall. So, how does such a vital, life-sustaining mineral just up and vanish in the first place? And why is it particularly prone to disappearing in people dealing with type 2 diabetes? Let's trace its steps. The primary cause is a biological process called osmotic diuresis. I know, that sounds incredibly clinical, so I want you to just picture a rushing river instead. When blood glucose levels get too high, your kidneys go into absolute overdrive to filter that excess sugar out into your urine. But that glucose doesn't leave alone. It drags water right along with it. And just like a fast-moving current, this rushing river of water washes your magnesium downstream and right out of your body, before your kidneys even have a chance to reclaim it. But that rushing river isn't the only thief in town. We've got some accomplices. First up, insulin resistance. You see, insulin doesn't just push sugar into your cells, it actually helps transport magnesium into your cells too. When your cells resist insulin, they also lock out the magnesium, creating what researchers actually call a functional deficiency. Throw in the fact that many modern diets are highly processed and totally lack whole, magnesium-rich plant foods, plus the fact that diabetes inherently increases chronic inflammation, which just burns right through your body's antioxidant defenses, and you can see exactly how quickly your magnesium reserves get wiped out. And this brilliantly illustrates how sometimes our attempts to heal can inadvertently compound the problem. Several really commonly prescribed medications actually worsen this deficiency. Certain diuretics, which are often prescribed for blood pressure, actively increase the amount of magnesium you flush out through your kidneys. On the flip side, long-term use of proton pump inhibitors, or PPIs, typically used for acid reflux, actually block your intestines from absorbing magnesium from your food in the first place. Now, obviously, you should never stop a prescribed medication without talking to your doctor, but it's a completely critical piece of the puzzle you need to be aware of. Section 2. The damage done. Worsening diabetes symptoms. Now that we know how it escapes, we really need to look at the collateral damage. What actually happens when your body is forced to operate without the very mineral it needs to power 300 different systems? Look, low magnesium is not just some passive background issue. It's an active threat to your health. When magnesium is low, insulin receptors become less efficient, which directly worsens your insulin resistance. Because magnesium helps blood vessels relax, losing it can literally spike your blood pressure. It's also linked to diabetic neuropathy, causing tingling, burning, and awful nerve pain. It is a prime suspect for those severe, waking you up in the middle of the night muscle cramps. And perhaps most dangerously, because it regulates electrical activity, low magnesium seriously increases your risk of abnormal heart rhythms. Let's move to and see how this builds into a literal vicious cycle. You start with low magnesium. That reduces your insulin sensitivity. Reduced sensitivity means higher blood sugar. Higher blood sugar triggers the kidneys to flush out more glucose in the urine. That rushing river takes even more magnesium with it, resulting in even lower magnesium levels than you started with. It is a trap where the diabetes feeds the deficiency and the deficiency feeds the diabetes. At this point, you might be thinking, well, hey, I'll just go to my doctor and ask for a standard magnesium test to see if I'm caught in this cycle. It sounds like the logical next step, right? But unfortunately, catching this culprit on paper is surprisingly tricky. Here's the dilemma with testing. The most common test your doctor is going to order is a serum magnesium test. But remember that donut chart from earlier? Serum only tests the 1% of magnesium that's actually floating in your blood. Your body will ruthlessly rob your bones and tissues to keep that blood level normal, meaning a serum test can falsely reassure you that everything is totally fine. There is an alternative, the red blood cell or RBC magnesium test. This looks deeper into the cells for a much better long-term picture, but frankly, it isn't standardized across labs, and it isn't always widely available. Because those standard tests can be so incredibly tricky, you kind of have to act as your own biological detective. You need to watch for the specific clinical clues your body is giving you. If you're experiencing unexplained fatigue, physical weakness, slight tremors, a racing or fluttering heart, or sudden numbness and tingling in your extremities, your body might literally be flashing a warning sign that your tissue reserves of magnesium are running on empty. Section 3. Breaking the cycle, catching the culprit. The great news here is that we can absolutely break this vicious cycle. We can restock those shelves. Now, what's really interesting about this slide is how easily we can do this just through food. Whole plant-based foods are naturally packed with this mineral. Hemp seeds offer a staggering 700 milligrams per 100 grams. Pumpkin seeds are right behind them. A handful of seeds, a serving of cooked spinach, some black beans, or firm tofu. Instead of looking for one magic superfood, just aiming to include a variety of these across your day can dramatically replenish your reserves. To give you a concrete target to aim for, 420 is the magic number for a lot of folks. According to the recommended dietary allowance, adult men over 30 need up to 420 milligrams a day, while adult women over 30 should aim for 320 milligrams. With just a few really smart, simple dietary tweaks involving seeds and greens, hitting this target is highly achievable. Now, you might be wondering about simply taking a pill to fix it. Well, clinical trials do show that for people who are deficient, magnesium supplementation can modestly improve insulin sensitivity and blood sugar control. But hear me out, they are a modest helper, not a cure. Supplements should complement your lifestyle. They absolutely cannot replace a healthy diet, daily exercise, or the medications prescribed by your healthcare provider. Food provides an entire symphony of nutrients that a solitary supplement just can't replicate. So, the crucial point is this. The research is incredibly consistent. Large prospective studies show that individuals who consume more magnesium-rich foods have a noticeably lower risk of developing type 2 diabetes in the very first place. And for those who are already managing the condition, maintaining adequate magnesium is simply one of the easiest, most accessible ways to support healthier glucose metabolism and guard against those awful long-term complications. I want to leave you with a provocative question to really chew on today. Are you just treating the symptoms of diabetes, playing an endless game of whack-a-mole with your blood sugar and blood pressure, while completely ignoring the missing mineral that powers the entire system from the ground up? By acknowledging the unseen role of magnesium, you have the power to break the cycle, restock your reserves, and give your body the exact tools it needs to thrive. Thank you so much for joining me for this explainer. Now go grab a handful of pumpkin seeds and take charge of your health.